Hi, my name is Summer Mattingly. Becca Newberry and I did a systematic review on workplace violence in the emergency departments. Our literature review reviewed 16 research studies that varied in qualitative, quantitative, with different methods, extracting data and critiquing them. The first question in regards to the problem: did the report clearly state the research problem and or research questions? Is the scope of the project appropriate? The study appropriately states the research problem. What are the characteristics and findings of studies since 2004 on workplace violence in the emergency department? The purpose for this review is to provide a research synthesis on workplace violence in the emergency department and to identify the characteristics of intervention studies that are the basis for guiding practice modeling in the practice setting. The scope of the literature review is appropriate, including unique types of emergency departments, worldwide populations, and specific criteria. Is the topic of the review important for nursing? This topic is important to nursing because it affects nursing professionals emotionally and physically. There is an increased risk for violence to occur in the healthcare setting. For example, 48% of all non-fatal injuries from violent acts and assaults occurring in the workplace took place in 2000. According to Mayhew and Chappell, across the various country-specific research studies, more than 50% of healthcare workers reported experiencing one or other form of workplace violence in the previous 12 months. Ambulance officers were at greatest risk, followed by nurses. This literature review educates nurses to become more proactive and accountable when workplace violence occurs in order to promote a safe working environment. This literature review states that staff underreports workplace violence, which creates a barrier in determining the depth of the problem. Were concepts, variables, and phenomena adequately defined? There were several concepts throughout the review. The first concept stated is the amount of workplace violence increases in particular areas in healthcare, such as the emergency department, psychiatric units, and or long-term care facilities. The second concept described is the definition of workplace violence, such as physical assault, emotional or verbal abuse, or threatening, harassing, or coercive behavior. Several of the studies measured safety at work or lack of fear as a major concept. The variables throughout the previous studies include timeframes and definitions used to measure violence in the workplace, specifically the emergency department. Researchers had difficulty comparing the different studies because of the difference in the definitions. In addition, the studies used did not use the same instrumentation when measuring workplace violence in the emergency department. An additional variable included is underreporting of workplace violence by staff within the emergency department. This systematic review consisted of qualitative and quantitative and phenomenology. The literature review provides an understanding of the phenomenon of workplace violence in the emergency department. The next question: was the integration approach adequately described, and was the approach appropriate? The researchers' approach was adequately described by searching 4 databases: Medline, CINAHL, PsycInfo, and the Dissertations and Thesis of Full Text database from March to June of 2009. When searching these databases, the researcher used multiple search terms to gather the greatest range of data. This approach was appropriate in finding relevant studies for this review. Search strategy. Did the report clearly describe criteria for selecting primary studies, and are those criteria reasonable? The review does state details in regards to how primary studies were selected. The selection criteria is searching multiple databases and terms. Among those studies were reasonable in addition to searching specific terms. The related articles option was selected in order to search for more articles. In addition, the reviewers included dissertations due to the lack of research studies performed in pediatric emergency departments. The reviewers state the reasoning for selecting and including the studies in this literature review. Were the bibliographic databases used by the researchers identified, and are they appropriate and comprehensive? The reviewers did not identify a bibliographic database if it was used in this literature review. However, each citation title was reviewed for possible inclusions, finding studies to be unrelated to the literature review. Were keywords identified, and are they exhaustive? Keywords were identified such as workplace violence, emergency department violence, aggression, and emergency in varying combinations. 1,000 studies were populated during the search by using the keywords previously mentioned. In addition, the reviewers used the keywords in a variety of combinations to populate more studies. Did the reviewers use adequate supplementary efforts to identify relevant studies? The reviewers did use supplementary efforts when identifying relevant studies for the literature review. The reviewers did include several articles that did not meet specific criteria because it was unique to particular types of emergency departments such as pediatrics. Was a PRISMA type flowchart included to summarize the search strategy and results? This review did not have a PRISMA type flowchart that summarized the search strategy and results. Now talking about the sample. Were inclusion and exclusion criteria clearly articulated, and were they defensible? The inclusion and exclusion criteria was clearly stated. The review included studies that were available in English and were of the original study that did or did not use intervention. Also, these studies took place in North America, Europe, or Australia and were published from 2004 to 2009. According to Taylor, the research studies ranged in size and type from community hospitals, pediatric emergency departments, to trauma facilities. The sample sizes consisted of 8 to 3,518 participants. 9 of the studies had a setting including more than one emergency department. The focus of these studies were workplace violence that was conducted in the emergency department. The sample included 2 studies that did not meet the original study criteria because the studies represented emergency department nurses throughout the United States, and it was the only study that met other inclusion criteria. Dissertations were included in the search due to a lack of studies performed in pediatric emergency departments. The dissertations were included because of the uniqueness of the study and the importance of including the pediatric emergency department setting in the scope. According to Taylor, articles were excluded due to the studies being commentaries or anecdotes or did not have a primary focus on workplace violence in the emergency department. Next question. Did the search strategy yield a strong and comprehensive sample of studies? Were strengths and limitations of the sample identified? The search yielded a variation among the study settings, sampling techniques, and composition of sample. The search located 8 studies that originated in the United States, 5 from Australia, and 3 from Europe. The studies used for the literature review were of qualitative and quantitative research. The majority of the studies utilized convenience sampling. The literature review did include a study that used random sampling to gather data. The limitations were the setting of the practice and the selection criteria for the study inclusions in the review. The time frame this review was performed is also a limitation, for it may have eliminated older studies that have valuable data. In addition, the literature review was conducted by a nurse who works in an emergency department. Every effort was made for the nurse to remain neutral throughout this literature review. However, there is a possibility that a bias exists. If an original report was lacking key information, did reviewers attempt to contact the original researchers for additional information? According to Taylor and Root, an ancestry search was performed for all the studies that were included in the review. The abstracts were read if the study could not be included based off of the title. In addition, if exclusions of a study was undetermined due to reading the abstract, then the reviewer read the entire article to ensure that the key information was present and sufficient to be utilized in the systematic review. The report was excluded if it lacked key information that was pertinent to this review. When multiple publications from the same study were found, the reviewers used the one that had the greatest amount of information. If the same research study populated multiple publications and contributed significant new information in regards to workplace violence in the emergency department, then they were included and were treated as separate research studies. If studies were excluded for reasons other than insufficient information, did the reviewers provide a rationale for the decision? The reviewer does state the reason for excluding several studies. The common reason was due to the studies not having a primary focus on workplace violence in the emergency department. The second reason studies were excluded was if they did not occur within an emergency department. They were commentaries and anecdotes. When discussing workplace violence, specifically in an emergency department, it is crucial that the studies being reviewed are similar and meet the same criteria. Studies performed in another environment would have multiple variables and incomparable to the data that was collected in an emergency department. This systematic review of the literature excluded all studies that were not focused on emergency department settings to increase the application of the finding directly to this clinical setting. The point of origin of the studies was limited to assist research progress in practice settings comparable to those in the United States.